Parent orientation, safe sleep policy. Agenda, safe sleep policy, practices, environment, training. Hello everyone, my name is Christine Damiani and I'm part of the leadership team at Canyon Lake United Methodist Preschool. I'm the assistant director. Safe sleep policy. Methodist Preschool is committed to providing infants with a safe place to grow and learn. For this reason, a safe sleep policy is upheld for infants up to 1 year old. We follow the recommendations of the American Academy of Pediatrics and the Consumer Product Safety Commission to provide a safe sleep environment and reduce the risk of sudden infant death syndrome. The staff, substitute staff, and volunteers will follow the recommendations for safe sleep. Practices. All infants are put to sleep on their backs in their assigned cribs as recommended by the American Academy of Pediatrics. Devices such as wedges or infant positioners will not be used unless a completed alternate sleep position waiver is on file. A waiver notice will be posted on the infant's crib. While infants will always be placed on their backs to sleep, when an infant can easily turn over from back to front and front to back, they may remain in whatever position they turn themselves to for the duration of their sleep. Preschool staff will make a note of the infant meeting this developmental milestone and inform parents and the other staff by labeling their crib. When infants are in their cribs, they will be within sight and sound of staff at all times. Practices. A staff member will record visual checks on the sleeping infants aged 12 months or younger every 15 minutes on ProCare, only visible to staff. We will be especially alert to monitoring a sleeping infant during the first weeks the infant is in childcare. We will check for the following: normal skin color, normal breathing by watching the rise and fall of the chest while sleeping, signs of overheating, flushed skin color, increase in body temperature, touch of the skin, and restlessness. Practices. Steps will be taken for the infant to avoid overheating. The temperature of the rooms where infants sleep will be monitored and will be kept at a level that is comfortable, which is between 68 and 75 degrees Fahrenheit. There will be no excess bedding or overdressing of children. Infants will not be swaddled, and swaddling apparel is not allowed. This includes all products or items with the word swaddle in the name or description. We do not allow garments that restrict movement. Sleep sacks will be allowed as long as they are not weighted in any way and do not restrict arm movement. When an infant is awake, they will be removed from cribs immediately and have supervised tummy time. This will help babies strengthen their muscles and develop normally. All parents, guardians of infants will receive a written copy of our safe sleep policy before enrollment. They will review the policy with staff and sign a statement saying they received and reviewed the policy. All questions will be discussed and reviewed with the directors. Environment. Our program will use Consumer Product Safety Commission guidelines for safety-approved cribs and firm mattresses. The crib will have a firm mattress covered by a tight-fitted sheet and will be free from mobiles, loose bedding, toys, and other soft objects. Infants will not be placed to sleep on any soft surfaces. Only one infant will be placed to sleep in each crib. Siblings, including twins and triplets, will be placed in a separate crib. The crib will have no toys, blankets, pillows, wedges, or other infant positioners, pillow-like toys, bumper pads, quilts, sheepskins, loose bedding, towels, washcloths, stuffed toys, or other objects. Nothing may be placed with a sleeping infant aged 12 months or younger. Methodist Preschool will allow pacifiers. Please, no stuffed toys, ties, or strings attached to the pacifier. Infants who use pacifiers will be offered their pacifier when they are placed to sleep. If the pacifier falls out of the sleeping infant mouth during their nap, the pacifier will be removed. Pacifiers will be cleaned between each use, checked for tears, and will not be coated in any sweet or other solution. Pacifiers cannot be attached to the child or have a stuffed animal attached. Bibs and pacifiers will not be tied around an infant's neck or clipped onto an infant's clothing. Infants that fall asleep in a location other than their crib will be promptly removed and placed in their crib on their back. Infants will promptly be removed from car seats by their parents, guardians at drop-off. Infants 12 months and younger are prohibited from sleeping in sitting devices, including but not limited to car seats, strollers, swings, and infant carriers. Infants that fall asleep in sitting devices will be moved to an appropriate sleep place and placed on their back. Training. All infant and toddler staff, administrative staff, rotating staff, and volunteers will be trained on safe sleep policies and practices every year. Documentation that staff, administrative staff, rotating staff, and volunteers have read and understand these policies will be kept in each individual's file. Before they are allowed to care for infants, all staff, administrative staff, rotating staff, and volunteers will be trained in first aid and CPR so they know how to respond to an unresponsive infant or toddler. We hope that this video will help you with confidence knowing all the ins and outs of the preschool's safe sleep policy. If you have any questions, as always, don't be afraid to message us through ProCare or by email.